bend the cost curve. Congressman Elijah Cummings joins us this morning to weigh in on all of this. Good morning, Congressman. How are you?
I'm doing great.
Now, House Democrats are really working to cut down the cost of their plan right now. They have actually cut it down from $1 trillion down to $800 billion. Still too expensive. Can we afford that?
We have to afford it. Right now, keep in mind recent reports, even right out of Johns Hopkins, telling us that 45,000 at a minimum Americans are dying because they don't have health insurance. We have to make a choice here. We're going to either protect our people and take care of them, or we're going to not. And we have no choice. The stars are aligned and we'll get it done. But the fact is that it's going to cost us. But I do believe clearly that the plan that we have now, as we cut and cut, is clearly within the range of what the president asked for.
And the Democrats are still very hardly fighting for that public option plan. Why is this such a sticking point still to this day? From day one, it has been.
Because we want competition. We want competition. In the state of Maryland, for example, 2 insurance companies represent 80% of the people. There's some states where only 1 insurance company represents just about everybody. So we've got to have competition, and we've got to have a way to bring the cost of insurance down. The president says you can keep your insurance, but if you keep your insurance and can't afford it, what's the use of having it?
All of this is coming at very hard economic times for the United States. Not long ago, the government helped Wall Street with their bailout.
Right.
Now it appears that some of that works. Some of the companies are having a profit right now, but Obama is now saying that he wants to cut some of the salaries from the top executives from those companies. Is that fair? Is that appropriate? Why is that fair?
It's fair because if the government, say for example AIG, we basically own 80% of AIG, the American public, without tax dollars. And we must have a say about how they're paid. My salary is controlled. Public employees' salaries are controlled. Why not AIG? And these are people who were giving themselves bonuses after they brought down our financial system. Something is absolutely wrong with that picture.
Well, their argument is if they did get the bailout money, but they've paid it back, they've also paid back their interest, then why should they still be capped?
Because we help them. We help them to get to where they are. These bonuses are out of this world. I'm talking about $1 million bonus for people that have been getting $1 million bonuses for years. While people in my district in Baltimore are watching this right now, are being thrown out of their houses, losing their savings, losing their health insurance. Something's wrong with that picture.
Do you think they are forever in debt to the government then, or at what point would the administration not have control over it?
I think there's a point where the administration needs to pull back, but the AIGs of the world, where we actually have money in there right now, we need to keep control. The other thing is it's important for the public to feel confident that their tax dollars are not being used in this way.
Now, at the same time, we're also dealing with a national pandemic. Swine flu has hit Maryland very hard. We've seen a number of deaths here. Obviously, there's a shortage for the H1N1 vaccine right now. Is there anything that can be done to make sure Maryland gets the doses that are needed to keep our people healthy?
No, because we're just, the production is a bit behind. There's been a phenomenal demand. A lot of people are very concerned because this hits children hard. Right. And so a lot of parents coming out, and I think probably more than we expected. But the fact is that we will have our $1 million doses by November 15th or thereabout. We thought it would be the end of October. And then but it's going to be a slow process, but people need to hold on. Let the priority folk get treated first, the pregnant women and our children and seniors, and then move on from there.
Should people be scared right now? Should they, be concerned?
No. I think we can't panic here. Again, even if, I hope no one gets it, but if they get it, there's certain things that can be done to address it. But the fact is that the vaccines are coming in. They'll be here just a little bit slower than we expected. But I think the Obama administration has done a great job in trying to prepare for this.
Now, we also want to talk to you about a seminar that you're holding for small business owners, helping them through all this tough time.
Next Saturday, we'll have a big Johns Hopkins from 10 until 2. A lot of small businesses do not know how to access the stimulus dollars. We'll be talking about that. We'll have representatives from the White House. It's absolutely free. They can call my office at 410-685-9199, and we'll be happy to register them. But again, it's 10 till 2 next Saturday after next at Johns Hopkins campus.
And there's also a college fair as well.
November the 9th at Enoch Pratt Library from 5 to 7. We'll have college representatives. We'll have scholarship information. People need to come out for this, even if they have a 9th grader. And college students need to come out because it'll be a one-stop shop with about 40 different folks coming in talking about college applications, SAT, and how they get the money.
Yeah,
and it's
free.
free.
To know right now.
And it's free.
Congressman Cummings, thank you so much as always.
Thank you.
Appreciate it. Coming up in our 7